And good evening. We begin tonight at 5 o'clock with the state's first confirmed case of measles and concern that more people here in Indiana potentially could get infected.
An unvaccinated child in Allen County is now stable and recovering. The State Department of Health says just one case is considered an outbreak because measles spreads so fast. So tonight we want to give you key information about prevention.
Jenny Renovich joins us live in studio after talking with a pediatrician today about the key points of what parents need to know. Jenny?
Yeah, the most important thing, guys, make sure your child is vaccinated. We're talking about the MMR vaccines. Doctors say vaccination equals safety from the spread. Measles is one of the most contagious illnesses out there. It can stay in a room 2 hours after an infected person leaves the room. It also comes with serious complications. What starts with a bad cough, severe runny nose, and very red eyes can lead to permanent brain damage, even death. Dr. Eric Yancey, a pediatrician here in Indianapolis, says he's troubled by the trend of measles cases growing nationwide. A shocking comeback for a disease that was essentially eliminated 25 years ago because of vaccines. But doctors say disinformation is leading to an alarming rise in cases now. So doctors are having conversations with parents, debunking myths and making sure young patients stay safe.
These are effective and safe vaccines. Millions of doses have been given. The absolute necessity to get your child vaccinated. That's the only real prevention for this. We can talk about herd immunity and natural occurring immunity after a disease. The problem with that is, yeah, you may get some natural immunity after measles if it doesn't kill you first.
Some sobering words from the doctor there. Want to let you know the MMR vaccine is usually given to children between 12 and 15 months, then a booster at age 4. But if you are not vaccinated right now, you can get the vaccine at any age. And I want to let you know there's actually a free mobile vaccination clinic that's happening tomorrow. That's in Johnson County at the fairgrounds. We have all that info on WTHR.com.
That's the most important thing. Arm yourself with info.
Right.
Yeah.
And thanks for all that information, and good news that this child up in the Fort Wayne area is recovering. That's the best part.
It is important news.
All right. Thank you, Jenny.
And tonight we're learning doctors have diagnosed more than 600 people across the country with measles this year.
Most of the cases are in the state of Texas, where right now they estimate there are more than 500 cases. The Texas Department of State Health Services has now identified 505 cases since the outbreak began in late January.
And 351 of those people are under the age of 18, with 160 of those cases being kids under 5. 2 children have died. As
far as doctors know, just 10 of the people diagnosed were vaccinated.
And let's give you some perspective here, and it's on the history of measles in the U.S. Listen. Back in 1912, the government required healthcare providers to report diagnosed cases. An average of 6,000 measles-related deaths were reported each year from 1912 through 1922. Doctors diagnosed 3 to 4 million people with measles each year between 1950 to 1959, and 48,000 of those people ended up in the hospital. The measles vaccine then became available in 1963, and by 1981, the number of reported cases dropped by 80%. Then in the year 2000, the measles was considered eliminated in the U.S.